Hi and good morning. My name is April Ybarra and I'm going to teach you today about proper phlebotomy technique. First, let me tell you a little bit about myself. I am currently completing the clinical practicum requirement for my Master's of Nursing in Education with the University of Texas at Arlington College of Nursing. One of my requirements in this course is that I provide a video of material that I have taught. With your permission, I would like to record today's material. At some point during the recording, you may be shown and or heard, so I will need your permission to film your person or voice. If you do not have any objection to appearing in this recording, I will need your signature on the video release form located at the corner of the desk. In the event you do not wish to appear on camera, we can have you sit outside the recording area. I thank you for your participation. I've been a nurse since graduation in the Associate's Degree Nursing program in 2004. I graduated with my Bachelor's in Science of Nursing in 2011 from the University of Texas at Arlington College of Nursing. I will graduate with my Master's Science of Nursing and Education in May of 2015, also from the University of Texas at Arlington College of Nursing. All of my career has been spent as a nurse in the emergency department. I have been with CHI Baylor St. Luke's Medical Center for the past 7 years, and I have been a clinical educator in the emergency department for CHI Baylor St. Luke's Medical Center since 2012.
Indicated it's very important in the order that you draw your labs, and the reason being is that the additive or the separator serum excuse me, in each tube does something specific for that tube. And if, just say for instance, if you draw your purple before your green, the substance in the purple can affect the potassium level in the green. So it's real important. You all have the little identifiers. Down in the ED, we have it on every wall in every room, just in case the PCA or nurse does not have their little cue card on their badge. But you want to try to familiarize yourself in the way that you're going to do that. Make sure that when you're preparing your stuff, you actually lay your tubes out in the order that you want to draw them, so that you don't get yourself turned around. That way you have actual accurate results when it comes out. Two, depending if they want blood cultures, your blood cultures should be drawn first. And it's very important that you're meticulous when you draw them. It is more than $5,000 in treatment cost for an erroneous blood culture. So if we draw it and it's contaminated, so we're drawing 2 sets, that's 4 bottles. If it's contaminated, the length of stay increases for the patient, the cost of care increases for the patient, and then again, they may be being treated for something that they don't have. So when you do your blood cultures, you're going to draw them in a specific order. Your aerobic, your green, is always going to be first. They're covered with a little tab. That doesn't mean that it's sterile underneath. It's not. So you need to make sure that when you pop your tab, you're going to wipe it with a little bit of agitation to get it good and clean, and you're going to let it dry while you get your patient ready for it. When you're done with it, you're going to wipe your tops again with your alcohol. Okay, very important when you do that. You don't need to wipe these tops, but on your blood cultures you do. Agitate it. You want to kind of scrub it a little bit
with the alcohol.
Yeah.
Something else?
No, with alcohol.
Yeah,
And the thing to remember is, it's like if you got an alcohol wipe for one bottle, you get a different alcohol
That's right.
wipe for the other bottle.
So what we do down there is we pop our tops and we do this so that we don't make a mistake and try to do two. And when I say agitate, you want to scrub it, because there could dust particles, any kind of microscopic. If it punctures down in here, it's now a contaminated specimen. Two, and like Miss Jenny says, you want to make sure you use a different one for each one. Okay, you have your gloves on. You want to look at your bottoms of your culture bottles. If they are yucky mustard brown, it's no good. It's a contaminated bottle, and it's not going to be an accurate result. So you throw it out and you get a fresh bottle. Okay.
So it's brown, throw it out.
Yeah, so it's
yellow.
See that mustard yellow right there?
That is no good.
That's no good.
Oh.
Yeah, it should be light gray in color, not brown. I mean, not yellow, pardon me. So if it's that way, for sure you want to throw
It's
it
kind of
out.
like a brown mustard, but yeah.
Yeah, kind of looks like baby food. Now, another thing that's very, very important, when you lysis a blood cell, you release what is within the blood cell. So it's very important when we're drawing potassium levels I see this all the time. As the video showed, they have the tourniquet on and they're slapping. You don't wanna do that. You're damaging your specimen. And then you don't wanna do this, because as that blood cell is striking the walls of this tube, it's busting open, potassium is being released. So they're gonna say the patient has an elevated potassium, and that's not good. So you just wanna slowly agitate it, at least 5 times, and then lay your specimen down, okay? No shaking of any of the tubes at all, for sure, because that will damage everything that you're going to do. Now, when you're picking your location, you're gonna encounter, at St. Luke's, we have such high acuity level, really sick patients. A lot of them have been patients here for a very long time, and you're gonna have ones that are right off the bat gonna tell you they're heart sick. Be confident, just because they say they're heart sick doesn't mean that they are. They just may not have had good experiences in the past. So as the video explained, you wanna check both sites. You wanna make sure that you're gonna get the best opportunity to get it on the first try. When you apply your tourniquet, think about our older population. You wanna be really careful. Let me demonstrate with you if you don't mind. You wanna be really careful. Their skin is thin and it can tear easy, and then now we've caused them something, that they didn't show up with. So don't put it on the skin. If they have their gown on, go above their skin. Put it over the top of their gown if you have to protect the skin underneath, or you can even use a washcloth, something that will give them a little bit of barrier. If you've ever had to do it, and I recommend that you should, when you put the tourniquet on, you're not doing it to like cut into them like this, but you want to give it enough pressure that it's going to actually let you fill up your vessels downstream, right? But you don't want it to tear the skin. And then when you go to release it, you be careful when you take it off, because if you don't do it the right way and you go to pull it, it's actually pulling their skin in opposite forces, and it's gonna tear it as well.
Question.
So you wanna be careful. Yes, ma'am.
So you're putting the tourniquet below the.
So you're gonna pick your site. You're gonna pick your site. So we're gonna say, I wanna get this vessel right here. You don't wanna put it way up here, because that's too much.
Yeah.
You wanna put it about 4 inches or so above where you wanna go, okay? And so you're gonna have already said, oh, that looks like a good spot to me. She can give it a good pump a couple of times. And if she's just laying in bed and nothing's happening, I recommend you scoot her over to the edge of the bed a little bit, let it kind of hang off, let gravity help you out. And then you'll see how it's filling up on its own.
Yes.
And it's painful. We've all had blood drawn at some point in our life, and they're slapping. It hurts.
Yeah.
You don't want to do that. You can take that same alcohol pad that I was using just a second ago and give it a little bit of irritation and see how it fills up that fast. And so then there's your site, you clean, and then you don't have to touch. You can, get your specimen. But you always want to keep the patient's safety, the patient's safety in mind. You don't want to cause them any injury. So you want to make sure you do that right. And then as the video talked about your sites, this is painful. There's lots of nerve endings down here in your hands. So, I'm not a good person to try to pick in my hands, but I have a good juicy one up here. Ask your patient, do you prefer right arm, left arm? Maybe they're right-handed, they don't want to be stuck over here. Where's the best spot for you? It doesn't hurt for them to help guide. Oh, they always get it. Because if you come look at me like this, you're going to think, oh my God, I'm never going to get this. But I can tell you, oh, I have a huge vein, right up here. Then you get it one stick, you go on about your business. Let the patient help you out a little bit.